video is brought to you by DrBarai. Please press on the subscribe button and the bell icon.
Hello everyone, this is DrBarai. In this tutorial we are going to talk about the sternoclavicular joint dislocation and subluxation. This is a little unusual presentation and we don't see this often. It can easily be missed, so I thought that we'll talk about it in a little bit detail so that we have got a very good understanding of this topic. With me we have got a couple of virtual assistants, Rebecca and also Rob. Hi Rebecca.
Hello everyone. I am Becky. As always, I am very excited to be here. Over the next few...
Alright, so let's set some goalposts. So first of all, we will talk about a little bit about the anatomy, about what is sternoclavicular joint, what are the different components. We'll talk about the dislocation and subluxation as well, how it happens. And next we are going to talk about the specific x-rays, special views like serendipity views, and then also we'll talk about the CT scan, which may be the gold standard investigation tool. As a physician or a doctor, our job does not finish at the diagnosis, so we'll go through the management options as well. As I am a physician working in the emergency department and urgent care, obviously my viewpoint will be for the clinicians for the emergency department and urgent care. For any orthopedic input, then you need to contact the orthopedic specialists. So first of all, what is this sternoclavicular joint and what is the dislocation and subluxation? Sternoclavicular joint is a joint between the medial end of the clavicle and the manubrium sterni. This is a type of joint where there is a disc inside it, so it is a type 2 cartilaginous joint, just like the pubic symphysis. When there is a displacement of less than 100%, that is called subluxation, and dislocation is when there is more than 100% displacement occurs. Subluxation is more common than dislocation, and there are two types of dislocation or subluxation that can happen: anterior and posterior. The posterior dislocation is worse, and this will emphasize on posterior dislocation more because that has got more adverse effect, and we don't want to miss the posterior dislocation. The anterior dislocation usually does not cause much problem other than bit of disfiguration, bit of swelling in the side of the neck, and also it can be a little painful. But posterior dislocation, that can be a time critical emergency, and we need to diagnose it very well early, and management options should be taken very seriously as a time critical emergency. So let's talk about a little bit of anatomy of the sternoclavicular joint.
This is a great friend of mine. He has very happily agreed to volunteer for some anatomy demo.
Oh.
It's my pleasure. Haha.
So this is the little skeleton, and as you can see, this is the manubrium sterni here. Then this is the left clavicle here, and this is the right clavicle. So this is the medial end of the left clavicle, and this is the lateral end. In the medial end, the clavicle is joined with the manubrium sterni, which is demonstrated by this green color. So there is right sternoclavicular joint here, left sternoclavicular joint here. What we cannot see in the skeleton though is the soft tissues. So in the center there is trachea, and then behind it there is esophagus. Then on the left side there is a left common carotid artery here, left subclavian artery here, and in front of those arteries there are the veins. So the left subclavian vein will be here, and the left internal jugular vein will be here. They join together to form the brachiocephalic vein, which will be running at this direction. The left brachiocephalic vein joins the right brachiocephalic vein to form the inferior vena cava here. So this is the structure which is very closely associated with many other important structures: the trachea, esophagus, the brachiocephalic vein, the common carotid artery, subclavian artery. So any type of dislocation or subluxation of this sternoclavicular joint, that can cause impact on those structures. That is why we need to know the anatomy and the pathology very well. All right, so let me show you a little bit more anatomy. So this is the same presentation like the previous skeleton. We have put some of the ligaments. So there is some ligament here, and this is called interclavicular ligament between the two clavicles, and this is the sternoclavicular ligament. There are mainly two components: the anterior sternoclavicular ligament and the posterior sternoclavicular ligament, that we cannot see from here. And also there is the ligament between the first costal cartilage and the medial end of the clavicle. This is the costoclavicular ligament, or you can call it chondroclavicular ligament as well. So the stability of this joint is determined by the intensity of these ligaments. If the posterior sternoclavicular ligament is injured, then that can cause both posterior and anterior subluxation or dislocation. So especially in case of dislocation, this sternoclavicular ligament, that can be damaged quite significantly. So this is a little bit more detailed anatomy. As you can see, in the center of the joint there is a fibrocartilaginous disc. So that is a classic presentation of the secondary cartilaginous joint. So in both sides that can happen, and if this fibrocartilaginous structure is damaged, then the manipulation of the sternoclavicular joint, that becomes very, very difficult, because it's just gets stuck there. And I have seen one patient like that. So we have got another picture here where some of the portion of the bone is removed for further elaboration. As you can see, this is the left clavicle here, and this is the intra-articular disc, which is a fibrocartilaginous disc, and this is the manubrium sterni here. So this is the right sternoclavicular joint, and this is the left sternoclavicular joint. If you carefully look at it, the first rib and the first costal cartilage, second costal cartilage, second rib, they are very closely associated with the sternoclavicular joint. So if there is an injury to the sternoclavicular joint, that invariably may be affecting those first rib and the second rib as well. And if there is a fracture of the first rib, that needs a lot of impact, and that can cause a lot of soft tissue injury, including the lung injury, vascular injury, the trachea or airway problem, and also esophageal problem. So exactly what I was talking about, just behind or posterior to the sternoclavicular ligament on the right side, we have got the brachiocephalic trunk here. This is the right common carotid artery, the right subclavian artery, and in front of those, these are the veins. The right subclavian vein and right internal jugular vein, which is joined together to form the right brachiocephalic vein, and on the left side, the left internal jugular vein and left subclavian vein are joined together to form the left brachiocephalic vein. So these two brachiocephalic veins are joined together to form the superior vena cava. Now, if we look at the sternoclavicular joint, these are very closely associated with those arteries and the veins, especially with the posterior dislocation. Those blood vessels can be compressed. As you can realize that if this brachiocephalic vein on the left side is compressed because of the posterior dislocation of the sternoclavicular joint, then the patient will have congestion, especially in the upper limb. There will be venous congestion. The head neck area, that may not be affected that much because of the collateral circulation on the right side or in the opposite side. So if we can understand this anatomy, then understanding the pathology becomes very easy, especially in case of the orthopedic conditions. So this is my little diagrammatic presentation. So let me orient you with this. So this is the manubrium sterni here. This is the right sternoclavicular joint here, the left sternoclavicular joint here. These are the blood vessels. On the right side, we have got the brachiocephalic trunk. On the left side, we have got the left common carotid artery, left subclavian artery, and in front of them, there are these veins. So what happens in case of the clavicular dislocation or subluxation? This is the medial end of the clavicle, this is the lateral end of the clavicle. In case of the posterior dislocation, this is what happens. So if there is an impact from the front,
Ouch. It hurts like hell.
I'm sorry about that.
Don't worry. We will fix it shortly.
Okay, we'll let's fix it. So basically, this is the medial end of the clavicle that is subluxed posteriorly, and that can compress this left common carotid artery or left subclavian artery and the veins, and that can cause a lot of problems. That is why this posterior dislocation or subluxation, that is a time critical emergency. So I understand that he is having a lot of pain. So let's manipulate it forwards. Here we go. So it is manipulated, and the pressure from that left common carotid and subclavian artery that subsided. Posterior subluxation dislocation is not very common, but that has got more adverse consequences. However, the anterior dislocation or subluxation, that is more common, and that is what happens this way. Usually this type of patients, they have got the impact on the shoulder in such a way that this posterior sternoclavicular ligament that is injured or snapped, and the anterior sternoclavicular ligament is bruised or snapped, and that is when there is the anterior subluxation or dislocation. It's very easy to manipulate, so all we need to do is give adequate analgesia or procedural sedation or even general anesthesia and push the medial end of the clavicle to keep it in the anatomical location. The manipulation of the posterior dislocation is sometimes a little difficult because it usually needs open reduction, internal fixation. However, if we just put a paper clip on the medial end of the clavicle and pull the clavicle forwards, then also we can treat the posterior dislocation of the sternoclavicular joint in that way. So let me talk you through about a patient that I have seen recently, and that was a very interesting case. We don't see sternoclavicular joint dislocation that often, but one or two that we can see. Sometimes we need to be very careful that we don't miss it. So I was working in the emergency department, and we saw a patient who is a 15-year-old girl, was playing rugby, and during rugby there is a lot of physical contact, and she was tackled. Severe pain developed in the left collarbone, and she was brought to the orthopedic outpatient as a fractured clavicle. I was asked to see the patient because there was some head injury and neck injury as well. When I saw the patient, she was still holding the neck in front of the neck, and she was saying it's sore, and she was also having some breathing difficulty and swallowing difficulty. She is otherwise fit and well, and she was accompanied by her mother. On examination, her vitals were absolutely fine. I have examined her head and neck area. There is no hemotympanum, no racuni, no battle sign, no obvious C-spine tenderness, no obvious restriction of movement of the neck either. Actually, she was feeling better when she was turning her face to the left side. So according to the various risk stratification tools, I thought she has got a very high risk injury. The injury to the left clavicle, that seemed to me that it is a distracting injury. So I thoroughly examined her. There was no focal neurological deficit. The vascularity was intact on both sides. Her main complaint was severe pain on the left side of the neck, left neck, and left collarbone or the clavicle. She was not moving her left shoulder that much because any type of movement in the shoulder was causing severe pain at the level of the sternoclavicular joint. So I was very concerned about this patient, and during the examination I felt that there may be some crepitation in the anterolateral aspect on the left side of the neck. I was not very 100% convinced, so I thought that we'll do some further test to see what's going on. The rest of our examination was unremarkable. There was no clinical feature of any pneumothorax or any pneumomediastinum in that matter. So let's have a look at the imaging. So we have done X-ray at first. So this is the way I interpret the X-ray. So I'll go through this X-ray in a little bit details so that we don't miss anything. So first thing I do is whenever I look at the X-ray, I make sure this is the right patient, right date, and right time, because in case of orthopedics we sometimes do the multiple X-rays before manipulation, after manipulation. And next I look at the views. Is it the epi view? Is it serendipity view? Is it a lateral view, oblique view? That gives us sometimes important information. Next I look at the adequacy. Are we seeing the both medial and lateral end of the clavicle in case of the clavicular views, or do we need some further imaging? I look at the alignment. Sometimes because of the malalignment, that interpretation can be quite difficult as well. The most important part in the X-ray interpretation is obviously the bones. I go through the cortex of all the part of the bone to make sure that there is no breach of continuity of the cortex that can indicate a fracture. And after the bone, I look for the cartilage to look if there is any damage. Obviously in the X-ray we cannot see the cartilage, but at the level of the cartilage, if there is some abnormality, then we find that something is not right. And after that we look for the joints. If there is any subluxation or dislocation, we also looked at the soft tissues. Does the patient have got some subcutaneous emphysema? Is there any foreign body? Is there any other vascular markings? And obviously when we look at the any imaging, X-ray or CT scan, we do the synthesis. We correlate.
Excellent stuff. Thank you.
Absolutely, thank you very much. So basically we interpret all these X-ray features with the patient characteristics, how the patient present. If the patient presents with severe pain and tenderness on the left side of the neck and left sternoclavicular joint, that is where my focus will be in the examination of the X-ray. So this is the X-ray of the clavicle. This is not specific serendipity view. So what it is showing is this is the clavicle here. If we look at the adequacy, it's not adequate because I cannot see the medial end of the clavicle very well. The lateral end of the clavicle looks fine. This is the acromioclavicular joint. Can't see any obvious fracture in the clavicle. Look at the ribs. There is no obvious fractured ribs, no pneumothorax that I can see. The glenohumeral joint or the shoulder joint looks enlocated. Cannot see any fracture of the scapula, and in the proximal humerus there is no fracture either. If we look at the subcutaneous tissues, soft tissues, there is no obvious subcutaneous emphysema. So that is how I interpret the X-ray. So my interpretation from here is this is a suboptimal view, left clavicular views X-ray showing no obvious bony injuries. However, I cannot exclude the injury of the sternoclavicular joint on this side. So I have arranged CT head, neck, and CT chest as well for this patient. And this is the coronal view. As you can see, the left clavicle, that looks beautiful. So this is once again the medial end of the clavicle, the lateral end of the clavicle, no fracture in the bone, no obvious soft tissue injuries I can see. This particular section does not show any airway problem, no breathing problem in the lungs, no circulation problem in the heart or the vessels. The most important view actually was the transverse section. Let me orient it with you the different components. So this is the manubrium sterni, this is the right sternoclavicular joint, this is the medial end of the right clavicle, and this is the medial end of the left clavicle. As you can see, this sternoclavicular joint should be here, but there is a more than 100% displacement of the medial end of the clavicle. So this is the posterior dislocation of the left clavicle. If you carefully look at it, there is quite a bit of soft tissue swelling here, and the trachea is deviated to the right, and that was actually causing this difficulty in breathing. If you look carefully look at the blood vessels, this is the brachiocephalic trunk, which looks fine to me, but on the left side, the left common carotid and left subclavian arteries, they are compressed a little bit, especially the common carotid artery on the left side, that is just touching the medial end of the clavicle. This is very concerning because the bone, it looks like quite smooth here. It's not sharp. It's not going to cause penetrating injury or puncture to the common carotid artery, but it can cause some bruises that we cannot see here, and this is a vascular cardiothoracic emergency. If we look at the rest of the scan, we can see that there is no obvious bony injury, although this is not a bony view. So my diagnosis from this particular section is there is a 100% posterior displacement of the medial end of the clavicle. So this is a posterior dislocation of the left sternoclavicular joint with some amount of effacement to the left common carotid artery. This is an emergency, and we need to get it fixed as soon as we can. I can still remember that the patient was in lot of pain, and we had to give lot of opioids to control her pain. There was no impairment of vascularity, no congestion, no reduced vascularity, no neurological, focal neurological deficit in this patient at that point when I have seen the patient. So this was the formal radiology report that there is a posterior dislocation of the left sternoclavicular joint, and the vascularity is intact, but there can be some further injury if appropriate steps are not taken immediately. So the management. We can have two different types of management, like most of the orthopedic conditions. We can have non-operative management, conservative management. Usually this is done in case of the atraumatic subluxation, or in case of the chronic subluxation dislocation for more than 3 weeks. My patient was immediate within 3 hours, and this is traumatic. So non-operative was not the best interest for this patient. In case of the non-operative management, we give analgesia, including opioids. Sling we can put on, it can be a broad arm sling, collar cuff sling. Personally, I prefer the shoulder immobilization sling. And also patient can return to activity in 3 months. By that time, the injury should have healed up. Because the patient will not move the shoulder, there may be some stiffness, so these patients might need some physio as well. The operative management is the cornerstone of management, especially in case of the posterior dislocation, which has got failed attempts of close reduction. Especially the patient may have dysphagia because of the compression over the esophagus. They can have shortness of breath or dyspnea because of some pressure effect on the trachea. There can be absence peripheral pulses because of the compression of the left subclavian artery. And of course, we need the cardiothoracic surgeon or thoracic surgeon present, and the resources should be available if we need to undergo this operative management. The place where I am working at this moment, we admit this patient under orthopedics rather than cardiothoracic surgeons. So there are two different techniques where the operative management can be performed. One is the open reduction and internal fixation with a thoracic surgery backup, and this is done under general anesthetics. The other option is the medial end of the clavicle excision. I am not going to get into further details of this operative maneuvers. However, if you like to have more further information, I would suggest you can go through various resources like the ortho bullets. So in my patient, when I have seen, initially I have contacted the cardiothoracic surgeons. They suggested orthopedic review. We have admitted the patient on orthopedics, went to the theater in the morning. Under general anesthetics, it was relocated in place. Did not need any plate or screws, so this was just relocation. So let's summarize everything together to get an overview. So initially I have talked about the various anatomy, and we have talked about what is sternoclavicular joint dislocation and subluxation. There are two types: anterior, which is common but less adverse effects; posterior dislocation or subluxation, that is more common, less common, but it has got more adverse effects, especially the vascular injury, airway injury like the tracheal injury, esophageal injury causing dysphagia. We also briefly talked about the interpretation of the X-ray. We have gone through in a systematic way, looking at the adequacy, alignment, airway components, the bones, cartilages, soft tissues, joints, and we have then summarized everything together and synthesized that. We also talked about the interpretation of the CT scan, and in my patient there was a posterior dislocation of the left sternoclavicular joint that can be shown in the CT scan that I have just demonstrated. Also, we talked about the management options. It can be conservative management or non-operative management and the operative management. From the emergency medicine point of view, I would get the orthopedic involvement early, especially in case of the posterior dislocation or subluxation. They can have a time critical life-threatening emergency sometimes, so you need to aggressively get the orthopedic consult, or if required the cardiothoracic consult for the adequate or appropriate management of the patients. So if you have got any further questions, please drop me a line. I'm happy to answer. Thank you very much. Now let me talk you through a few resources.
Ortho Bullets is simply a fantastic site. I look up trauma cases here all the time.
Absolutely. So Ortho Bullets have got very good materials for various fractures and dislocations. They have got a lot of static images. So they have shown some picture of the patient, as you can see here. This is the anterior subluxation of the left sternoclavicular joint, and yeah, they have got some various further reading materials as well. Radiopedia has got some interesting stuff as well. They have one article on anatomy and a few articles on subluxation or dislocation as well. This is the particular article which I would like to refer you to. It's a review article. It has talked about the various aspects of the sternoclavicular joint dislocation, anterior dislocation, posterior dislocation, and how to manage them. And a little bit further details. There are a lot of images as well. And in YouTube, I have got a video, or quite a few videos. So especially if you go through the playlist in my YouTube channel, it has got a lot of videos on the sternoclavicular joint and other orthopedic conditions. A lot of materials for emergency medicine and urgent care, and a lot of materials for POCUS or point of care ultrasound as well. With regards to reference, I particularly would like to refer you to the OrthoBullet article, but also Radiopedia has got some articles, and this article I have just talked you through. This is from World Journal of Orthopedics. They have got in full detail both diagnosis and management. Okay, thank you very much.
Okay folks. Thank you for watching the video. Hope you have enjoyed the video. You are so awesome. If you find it useful, please like the video, subscribe to the channel and share it with others. Please write comments below the video. For every comment that you write, positive or negative, I will personally give a cookie to my cat Lucy. I promise I will do. If you have any burning questions, constructive suggestions or some awesome ideas, please get in touch. We would love to hear from you. Your comments and suggestions are very important to us. You can contact us through email, Twitter or DrBarai's webpage. Thanks once again. See you soon. Bye for now.
Thank you everyone. Thank you Becky, and thank you Rob. That was fantastic for your help and support. Okay, I will see you all in next week. Thank you very much. Bye for now.